these pauses are due to start tomorrow. Are you optimistic they can actually happen?
I am hopeful, but not optimistic. There's certainly been nothing in the history in the past 10 months that has spoken to the validity of pauses. And these are only going to be temporary pauses, and they're only going to be in certain areas. So people are going to have to figure out whether they want to be as safe as they can, or whether or not they want to come out to get these vaccines. So
Yeah.
I'm hopeful, but not optimistic.
And talk to us about the logistics of that, because as you say, it's a time-limited pause in certain places in the territory. So, if you've got a young child that's unvaccinated, you're going to have to travel there by whatever means you can, I guess, to make sure you're in the line.
Whatever means you can, since the roads are destroyed. So the timing is supposed to be from 6 o'clock in the morning to 2 o'clock in the afternoon. That's 8 hours. Now, it doesn't really mean that's not 8 hours of work. That means that in these areas that are deconflicted, where there's a pause, you're supposed to be able to leave your shelter at 6 a.m., but you have to be back in your shelter, back at your shelter by 2 p.m. That means that 8 hours is really probably only 7 at the best. And when you look at and that's the safety issue. When you look at the efficiency issue and the efficacious issue, you're talking about in these 9 days, maybe 10 days, you're talking about having to vaccinate 9,000 kids per hour. And so the logistics of the math of this is very, very hard to figure out. Now, you're going to hear over the next few days that this is better than nothing, and thank God it probably is. But the concept of being able to vaccinate 640,000 children in 9 or 10 days at 8 or 7 hours per day is very, very hopeful at best.
Doctor, we've been talking about this story for a couple of days, and I didn't even sort of put that through my head, the maths of being able to reach this figure. The World Health Organization are going to be the ones leading this. Have they got the sort of logistics in place to be able to do this? I mean, enough people to administer the vaccines?
I don't know. I don't know. They have, there's estimated to be 2,500 people that are going to be active in the delivery. The delivery is simple itself. I mean, the delivery is you press a little container that has 2 milliliters of vaccine in it. So the delivery is not a problem. But access to the sites are, and they're doing it, in most places, they would normally do it, the workers would go from door to door. Well, obviously, in this situation, that's literally impossible. And also from the standpoint of safety, both for the workers and for the population, it's quite difficult. Just yesterday, there was an attack on a convoy of international NGO where 4 Palestinians were killed, and this was in a supposedly safe area. And remember, this is not a ceasefire. These are pauses in certain areas in a very small country where the fighting is going to continue on both sides at all times.
Yeah. Look, Doctor, when it was announced, I guess that in all of us there was a level of hope that it would work, but the closer we get to it actually now starting, and as you lay it out there in very clear detail, it does seem like it's going to be a really difficult challenge. It's going to be quite the test moment, isn't it, to see whether or not this can be achieved?
Well, this will be a case study, of course, and it'll be of enormous nature. I mean, the logistics are simple, but certainly not easy. And you also are in a situation where probably nobody on the ground, there hasn't been a case of polio for 25 years in Gaza. So, and literally half of the population is under 18 years of age. So virtually no one other than the healthcare workers and people my age have actually seen polio. So you're asking a group of people who are already terrified, have been terrified for 10 months now, to come out to receive something that they're at the best cautious about because of what they've heard. There's been a very active program, public health program, trying to increase awareness, but I'm not sure how effective it'll be. It's a major undertaking.
It's a question of vaccine hesitancy, isn't it? That is prevalent in many places. Look, this is the first one for polio. What about future diseases as well? What will this tell us about the
Well,
ability to
this
try and deal
is
with
so.
those?
So what this tells you actually is that not just the healthcare system. You see that every day. You see the hospitals bombed and these terrible pictures, terrible pictures. But that's the tip of the iceberg, because the public health system has saved more lives across the world than anything else. And the public health system has both workers and infrastructure, and the workers have been killed and the infrastructure is completely destroyed. So God forbid a case of cholera comes into the strip, because if a case of cholera comes into the strip and starts spreading because of the poor hygiene and because of the lack of appropriate sewage and things like that, there'll be deaths that begin to escalate geometrically. So any waterborne disease, this is a complete setup for it.